So I was gonna get the Novavax, but then a strange thing happened, and all of a sudden I felt this need to dig my heels in and say, hold on a second, let me rethink this one.
We've been patient, but our patience is wearing thin. We're going to protect vaccinated workers from unvaccinated coworkers. This is a pandemic of the unvaccinated. And a distinct minority of Americans, supported by a distinct minority of elected officials, are keeping us from turning the corner.
I think I'd rather go to a COVID party than be forced into submission by people I don't respect. It's one thing to offer donuts or to pay people to get the vaccine. People still have their own minds and can make their own choices, and that's fine. But now you're saying that little squishy, wrinkly vestigial organ you have up there, I know you think it's very important, but you can forget you even have a brain and we'll do all the thinking for you. In fact, we insist. That was not a well thought out message.
The president's actions in a mandate hardens the resistance.
In New York, the mandate forcing one hospital to turn away expectant mothers after staff members quit.
The number of resignations received leaves us no choice but to pause delivering babies at Lewis County General Hospital.
Have you found anything that is capable of changing someone's mind at this point?
Frankly, I have not. Folks are really dug in, and it seems the harder you try, the further they go.
I know when someone's not intimidated, and this woman's not intimidated, and the MSNBC lady is like, shut up and know your place, please. I went to Harvard. I think you worked at Red Lobster. And Nicki Minaj was like, what? And went completely crazy on her. And it's just so interesting and heartening.
I love to see it.
To see someone who's not afraid in America. There's still a few. I guess it's left to a rapper from Queens, but good for her.
The world works in mysterious ways.
Biden is now less popular with black voters after his vaccine mandate rollout. According to the Morning Consult, the president's net approval rating has fallen 12 percentage points among black voters, driven by a 17-point drop among unvaccinated black voters. Only 28% of black New Yorkers aged 18 to 44 were vaccinated. And the latest and loudest voice against vaccine mandates is Black Lives Matter of Greater New York. Black Lives Matter of Greater New York says vaccine mandates are a racist social distancing practice. Like the larger BLM group, the New York BLM group raises questions about how minorities are treated.
And you got to kind of wonder if people like this standing up might awaken others that, I don't have to be pushed around, actually.
Right, and that's like what it really comes down to. This is about body autonomy, no matter what side of the aisle you're on. I personally believe, from the bottom of my heart, that more people will get the vaccine if they just had an honest conversation. Right. There's so much gaslighting going on, especially people that have already gotten the vaccine, right? People have gotten the vaccine and said, it made my arm itch, and they're going, you're a liar. I'll get to Nicki Minaj. You're a liar. That never happened. How dare you say that? These people are on your side, vaccine industry. You're gaslighting people that actually listen to you. Why don't you just have a meaningful conversation and say, you know what? This might be rare. Maybe it did happen, but you're going to be just fine. They won't do that. And that is why people do not trust them at this moment.
It's totally true. There are about 8 people in the whole country who are against all vaccines. No one's against vaccines. They just don't want to be lied to or bullied. They do want to prey on it and make their own decisions. Nicki Minaj is right about that.
I was half joking about not getting Novavax. I'm leaning still towards getting it because I refuse to let the words of any politician or celebrity sway me on medical decisions. But I feel very strongly that nobody should ever be put down for asking questions. What do we tell kids? There's no such thing as a dumb question, because we want to encourage them to grow intellectually. Not allowing questions isn't just unscientific. It's the opposite of scientific. But this is the world in which we now live. Every day is opposite day.
It's the first step down a dangerous road where there may someday soon be two sciences. There's the science for the people who want policy A, and there's the science for people who don't want policy A. And each group is going to say, we're following our science. But that's not science. That is the misuse of the term science. Now, you might remember a few months ago, it was Pfizer who announced that they're going to push forward with a booster. And they initially got some pushback from the CDC, from Fauci, from the White House, saying, whoa, we haven't seen any data that makes us consider boosters. Then, of course, there was a private meeting, and from that moment, the dominoes started to fall. The White House announced that they're going to have boosters by September 20th, and that the FDA, well, of course, it was pending the FDA's analysis to make sure it was safe and effective. And in response, two senior officials at the FDA, Marion Gruber and Philip Krause, have resigned. The fact that two FDA officials have resigned who've had long terms at the FDA, we're talking decades, this should give us all pause. So this is the moment that many of us were worried about would happen under the prior administration, that there would be a push to use low levels of evidence for a mass vaccine campaign. But it is in this moment, it is in this administration.
The FDA, the Food and Drug Administration, is the agency that regulates big pharmaceutical companies. And it's funded by those same big pharmaceutical companies. Can you see any potential problems in the FDA being funded by the big pharma companies that it's regulating? While the number and speed of drug approvals have been increasing over time, so have the number of drugs that end up having serious safety issues coming to light after FDA approval. Wow, that's amazing. So there's a consequence to that. When you approve things quickly because of economic reasons, profit-driven reasons, down the line there are problems. Of course there are. Of course. Some potential reasons that more adverse effects are coming to light after the drug approval include senior FDA officials overturning scientists' recommendation. A Yale-led study showed that nearly 1 out of every 3 drugs approved by the FDA have a new safety issue detected in the years after approval. Have you not noticed people in the public space now talking about science? Hey, it's science, trust the scientists. These are the scientists! Instead of a regulator and a regulated industry, we now have a partnership. The FDA also increasingly allows drug makers to claim success in trials based on proxy measurements instead of clinical outcomes like survival rates or cures, which take more time to evaluate. In return for accelerated approval, drug companies commit to researching how well their drugs work after going to the market, but these post-marketing studies can take 10 years or longer to complete, leaving patients and doctors with lingering questions about safety and benefit. So they're sort of closing down potential avenues for the truth getting out by paying off every single person, shutting down proper review, research and understanding. It's a sort of totalitarian dome of deception.
Understand what it is that we're fighting here, and it is an elite cabal of people that control the flow of information. They control the flow of conversation. They control who we like and who we hate.
We are unwilling or unable to have conversations with people because everyone is looking at different tribes as an existential threat.
There is a reason for us to want to be in a group when there is threat, right? There is safety in numbers. We are protected when we are part of a group.
And so we need each other. And the only way that we can survive the fact that we're different and the fact that we need each other is by continually talking. We have to talk constantly. It's like, well, how much of what we're doing should we preserve versus how much of what we're doing should we transform? And the answer is, we don't know because the environment keeps changing. So what do we do about that? We talk.
Nobody disputes that this virus is now endemic. But the people who claim to follow the science, I don't think they know what endemic means. Endemic means we are not going to eradicate it. In other words, we are guaranteed that each and every one of our immune systems will meet and face off with SARS-CoV-2. No policy or mandate will stop this from happening. This can be hard for some to accept, and maybe that's the reason for some of the irrational behaviors that we see.